Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also make use of the playlist. In the playlist, I have provided almost all the topics so far discussed in a very systematic order. So this is quite convenient for the study. So my dear friends, we are discussing about fever, approach to fever in children. Already we have covered 13-14 parts, and we are discussing about 5 important questions that we have to ask with the parents whenever a patient comes to you with a fever. The next question is progression of the fever. Now, uh, usually we need to observe the progression. If the dark clouds comes, you don't open the umbrella always. You will always wait for the rainfall. This is we have discussed in the last class also. So don't ask when the rain will going to fall. We don't know. Okay, but don't ask what's the diagnosis today. Similarly, when the only fever is there for 1 or 2 days, don't ask any diagnosis because diagnosis is not yet over. It is just like clouds which are coming, and we don't know when the clouds will go into rain. But you should be very ready, and also you should be careful and alert, and you should observe all the changes and new symptoms which are coming, because a new symptom which is coming, that is very important for us. When there is only fever and one find a new symptom like throat pain comes, like irritability, like dyspnea, like abdominal pain, like vomiting, like burning micturition, this new symptom suggests that where exactly that pathogen get localized. Okay, so if you explain this to the parents, so they will be thankful to you, because nobody will ready to want to swallow the drugs unwantedly. Okay, administration of drug to the children is also very uh, difficult job, so they will always remember you if you make them convince. So exceptions are always there, so we should master it later, but in the beginning we should go by the rule. Okay, now, so progression. What is the progression in case of viral fever? See, nature of the viral fever starts very suddenly. There will be very high fever on day 1, day 2, and also day 3. But day 3 onwards, the viral fever intensity goes on decreasing. This is a very important thing. Viral fever will be peak on day 1, 2, and 3. But fourth day onwards, what happens is the intensity of the viral fever comes down, and by 6 or 7, 8 days, the viral fever completely get vanished. So this is the nature. So if the pattern of progression pattern is following this particular method, then definitely it is a viral fever. It's a viral fever. Now, suppose if it is a bacterial fever, how it start? On the first day, the fever will be very mild. Second day, still more. On third day, fourth day onwards, the fever reaches the peak, it attains the peak, and it will continue, and it will going to continue. So this is the pattern of fever in case of bacterial infections. We have to remember. Suppose you have given some antibiotics etc. in the early part itself, day 1 itself, the course of the fever may going to change. Therefore always we say don't go for unwanted medications in the fever. Okay, just wait and watch. Okay, so if you start with the antibiotic in the first day or second day, or unwanted medications, then this pattern cannot be seen. Otherwise, this pattern will be seen. In a bacterial fever, usually day 1 mild fever, day 2 still moderate fever, and day 3, 4 onwards it will be peak, and then when it reaches the peak, it is quite clear. That means on the day 3 or 4, it is not coming down, it is increasing. Then it is quite clear that this is a bacterial infection. Then we have to start the medication. That is what exactly Ayurveda also say. Just watch the Navajvara for 6 days, and if after 6 days also it is not coming down, some new symptoms arises, then it should be considered as Sannipata Jvara. Okay, it should be considered as Karna Mulashota is mentioned. So it should, new symptom is coming, a localization takes place. Okay, so it should be considered as Sannipata Jvara, and accordingly now the treatment should be followed. Otherwise, there is no mentioning of the treatment. So this is how to different the progression in case of a bacterial fever. Now, what about the immunological fever, immunological fevers? Okay, it is same. That means, see, this is a very important thing in case of immunological disorder. How to differentiate? See, immunological fever, day 1 Immunological fever, you know that it comes with a long interfebrile period, and rhythm will be long. So on the day one also the fever is same. Day two also the severity of the fever is same. Day three also same. Four also same. Every day the fever is coming in a long interfebrile period with the same severity. This is the typical nature of a immunological fever. If the day one it is mild, on the day 8 also it is mild only. Okay, in the day 2 it is very acute or high fever. Day 8 also 8 fever. So there is no change, stable. The progression is almost all stable, similar. So this is the typical nature of an immunological fever. Again, if you are not interfered with unwanted medications, you will get this particular pattern. Otherwise, this pattern may not be seen. Okay, so and malaria, that means parasitic infection. Immunological is over. Now parasitic fevers. In case of parasitic fevers, also same. The There is no progression as the day passes, or there is no decrease as the day passes. Okay, fever will be same. Every time the fever is coming, it is coming with the same severity. So this particular question will going to help to rule out so many important aspects. Okay, in the diagnosis of a fever. Now we come to the last question that we have to ask, that is associated symptoms. What are the associated symptoms? So see, always if you are getting associated symptoms, then you will be lucky. See, suppose fever is there with the sneezing, fever is there with the nasal blockage, rhinitis, fever is there with the cough, then it is quite clear that so many associated symptoms are there, prodromal symptoms are there, so that suggests this is a viral infection, because multiple symptoms, multiple system involvement is one of the typical nature of virus. Okay, and if there is an associated symptom, for example, fever is there with the throat pain. Okay, only one symptom, fever and throat pain, then it helps to again identify the bacterial fever, because localization takes place. Fever is there with vomiting. Yes, on the day one itself fever is there with vomiting, then you are very lucky, because we are able to localize the fever at the earliest. Okay, otherwise we have to wait till the formation of the new symptom for the diagnosis. So throat pain, nausea, vomiting, burning micturition, the irritability, difficulty in breathing, a running nose, etc. So these are all the associated symptoms. Malaise sometime, okay, body ache, and the loss of appetite. So these things will be there. They are all actually constitutional symptoms: loss of appetite, then malaise, and all, loss of weight, etc. But these extra symptom, if it is available on the day one, then you are lucky, because you can able to make the diagnosis very earlier. Okay. So this is the last question that we have to ask. From the next class onwards, by taking the knowledge of last 14 parts that we have done regarding approach of the fever, we shall discuss some of the cases. Okay, in the cases now we will be very, very particular what is the diagnosis. And if you look into the 7 or 8 cases, then you never commit any error in diagnosis of the fever, especially in pediatric practice. So that series we will start tomorrow onwards. Thank you very much.